Hello friends, today we will be discussing about pre-op instruction for a hair transplant procedure. As you all know, hair transplant is a surgical procedure, so we have to give certain instruction before the surgery. हम सर्जरी के पहले कुछ स्पेसिफिक इंस्ट्रक्शन पेशेंट को देंगे so that पेशेंट की सर्जरी ठीक ठाक हो जाए. It goes off uneventfully. So first of all, we should take a relevant history in our pre-op consultations, which is very much important, like any history of anticoagulants intake, tablets such as blood, which is mainly blood thinners in the form of ecospirin or any other blood thinners that the patient might be taking for other conditions in his medical history. Then we should also take the history of allergy to medication. Allergy to medication mainly becomes important because patient is given antibiotics and painkillers. So allergy can be precipitated after the intake or injections of analgesia. So this has to be taken care of before the starting of the procedure. Thirdly, we also need to take out the history of the local anesthesia allergy, local anesthesia reaction, because xylocaine can cause reactions in OT, which is very rare, but just to rule it out, we have to take a history. If the patient has already taken local anesthesia before in the form of injections for tooth extraction or any other small surgeries like cut injuries, then the risk is almost obviated. These are the history that we are taking mainly in relation to the allergies that the patient can have. Apart from that, we also need to rule out the intake of smoking and vitamins, multivitamins, and application of minoxidil. Intake of multivitamins, mainly vitamin C, can also cause a little bit of blood thinning. Therefore, it has to be stopped at least 5 to 7 days before the surgery. Similarly, smoking causes small vasculature problem, the constriction. Therefore, smoking also needs to be stopped at least 2 weeks prior to the surgery. And smoking also has a relevance that it has to be stopped following the surgery also for around 2 to 3 weeks. Minoxidil is to be stopped around a week before because minoxidil application on the scalp causes vasodilatation. Vasodilatation means the blood supply increases in the local area. So if you stop minoxidil, obviously it comes back to normal. Therefore, the bleeding tendencies is not increased at the time of surgery. So these are the conditions, or these are the instructions that will advise to the patient so that he stops using the medication. Now coming to the specific pre-op instruction for hair transplantation. Patient has to come to the clinic on a cab or in his cab with a driver because he cannot go back alone. He is already under the anesthesia, he will be mildly sedated, so he cannot drive back home. So he has to go back by cab or by his own car if he has a driver or some relatives. He cannot drive on his own. So basically he has to have the accompaniments along with him while he is coming for the surgery. Secondly, he has to come to the clinic with a front open shirt. He cannot wear a vest or a pullovers because when he is pulling out or putting in the pullovers, then there is a chance of this cloth or the garment getting stuck to the grafts, the transplanted grafts, so they can come out in the process. Thirdly, the patient is advised to take a antibiotic and a steroid medication just a day prior and in the morning of the surgery. This is just to build up the dose of that antibiotic in the blood at the time of the surgery. Patient is also advised to have a good scalp shampoo a day before so that the scalp is nicely washed and cleaned. So the blood test is already advised before the surgery. We have already checked the blood test reports and we tell the patients to get the blood report along with him. And we should doubly cross-check the blood reports in the patient. At times there can be little deviation and that should not be overlooked. So when we are doing the hair transplant procedure, we start the procedure with marking. So marking is never properly done if the patient comes in a shaven scalp because we have to see the thinning area. When the patient is coming for a hair transplantation, the main requirement is to fill up the area where the patient doesn't have hairs, that's bald areas. And another part of the scalp which is important is the progressive thinning that happens beyond the bald area. So this delineation cannot be nicely marked if the patient is coming to the clinic with a shaven scalp. So we need to have the patient with a scalp with hairs so that we can mark the bald area and also the thinning area nicely. Similarly, we also need to instruct the patient not to shave the beard, because nowadays the transplantation is always a combination of scalp and beard. So if we shave the beard, then seeing the beard and extracting the beard becomes very difficult. We need to have at least 1 to 2 millimeter length of the beard at the time of the surgery. So shaving the scalp or shaving the beard is not advisable, at least for 3 to 5 days before the surgery. Also, it's advisable for the patient to start practicing sleeping in prone position. Prone position means on your stomach, right? Because when we're doing the hair transplantation, the extraction is done in a prone position when you are lying on your tummy, because the extraction is taken from the back of the scalp. So you're just lying like this and we are picking out the hairs like this. So that duration is sometimes can extend on to 3 to 5 hours if the number of grafts is more. So if you practice prone position beforehand, then it becomes comfortable for you to sleep or to lie at the point of extraction. You are not uncomfortable and you can easily pass that 3 to 5 hours duration at ease.